My name is Ellen Heed, and I am a sexological body worker. Sexological bodywork is a modality that was developed in the early 2000s as a professional training, and it's recognized as a certification in the state of California, where we as sexological body workers have scope of practice to touch the pelvic floor for purposes of education. The pelvis is the center of our body, and it is where our center of gravity is, particularly for women. The pelvis is where gravity sits. For men, sometimes the center of gravity is in the upper body, but for women, typically our weight, our center, our creative juices are in the pelvis, coming from the pelvis, and the pelvis and pelvic health is central to our joy in life. So getting our pelvic health optimized is really where women could use some awareness, is in opening themselves to the potential of their pelvic health rather than living with little things that they don't even maybe know are bothering them but are yet interfering with big aspects of their lives. For instance, radiation can create scars in the pelvic floor. Some women have cervical cancer and they end up with getting treated with radiation, and those radiation treatments can create adhesions that literally fixate. If this is the uterus and this is the cervix and this is the vagina, the cervix can get fixated into the back of the vaginal wall. When a woman is sexually aroused, normally the uterus moves and the cervix moves. What does it move away from? Out of the way of incoming penetrating objects. So you want a uterus that can change position and a cervix that can change position. But if there's fixation and adhesion that's holding that uterus in place, there's no movement possible, and certainly cervical impact will be a reality, which can create crampy, painful, uncomfortable sex. And it's so easy to remediate this. It's just, just a little bit of contact with a little bit of castor oil where the cervix is fixated at the back of the vagina. It takes seconds. It takes about 3 seconds. And there's no pain in breaking up those adhesions. The castor oil breaks up the adhesions just because of its action on connective tissue. I have thousands of hours of experience doing hands-on scar tissue manipulation to help women regain sexual function, to help men regain sexual function, working with muscles, working with organs, working with nerves, and working with blood delivery. That's really what my goal is to improve all of those layers and how they function together to create health and optimal pleasure and the pleasure potential in the pelvis for everyone. I work with midwives, I work with doctors, nurses, osteopaths, and other professionals to teach them about scar tissue remediation in the pelvic floor. And that's my passion.